I'm Dr. Josh Satterlee from Biomechanics of Las Vegas. We're the premier active release technique and chiropractic clinic for athletes here in Las Vegas and Henderson. We see a lot of people with a lot of the same condition, and unfortunately they've come in labeled with this condition and they tell us, oh, I've had bursitis for 4 or 5 years, I've had tendonitis for 6 years. And oftentimes we end up solving their problem because what we try and do is step back and look at this in parts and pieces. Don't just accept this label that they're never going to get better, or that only with rest. Take 4 to 6 weeks off is kind of the death sentence of endurance athletes we work with. So I want to talk right now about bursitis and what causes it and how can we treat it. And this isn't too difficult if we break it into easy parts. A common injury or type of bursitis we see with endurance athletes is at the hip. On the side of our hip we have the greater trochanter, which is that big bump you feel right here. It's the attachment point for a few muscles, and over the top of it is a bursa. Okay? A bursa is just a fluid-filled sac that reduces friction of structures running over the top of bone. So if we use that greater trochanteric bursa as our example, our hip bone comes down like this. Here's your greater trochanter. On top of that will be this bursa sac, and I'm not drawing obviously to scale, but we want to get an idea. It keeps you from rubbing on that bone, or keeps these structures. Over the top of that, there are a lot of structures, gluteus medius, IT band, some of the other hip rotator muscles, and they're either coming in to attach here or they're running over the top. So why does that bursa get inflamed? It's pretty simple. It deals with friction from these structures. And as you increase this load against that bursa, and therefore against the bone, that bursa sac will become inflamed. So all we need to do, instead of focusing on the bursa as the cause of the issue, what's really happening is there's this tension in these structures. If we reduce that, they will therefore reduce this load, and therefore your pressure goes down. Oftentimes we'll treat these people, endurance athletes that have had this for years. We treat those structures, reduce that forceful tension that's pushing the bursa in, inflaming it, causing bursitis. They stand up and immediately they recognize, wow, that's different. I feel better. I feel like I'm healed. I've often had people that ran 3 miles and their hip would become inflamed, and they get up and they run 9 miles, no problem. And I'm not saying that we solve every case like that, but once you respect the pathology and the anatomy, these cases become very easy. And that's one of the great things about ART is we've identified and honed our skills in anatomy and identified every single protocol, multiple protocols sometimes for the same muscle. We look at all of those. I think there's over 400 protocols within the ART program because we want to be able to fix every problem. And when you break this into parts, muscle, tendon, bursa, and bone, it becomes simple.